Good afternoon. This is Nancy Anderson from SMI, and I'd like to welcome you to this continuation of a series of huddle calls for SMI members during these dreadfully and challenging times. This is our last in the huddle call series because we'll be starting our Vision 2020 sessions on Tuesday, May 19th. Registration is still open for all of our SMI members, so make sure you sign up for this series of educational and networking sessions. We have some great creative ways for members to virtually connect, and we're really looking forward to seeing all of our members online. We continue to be so grateful and so inspired by all of you, both suppliers and providers, who are on the front lines working so hard to help our healthcare system deal with this crisis. And thank you for sharing your very valuable time with us today. As in our previous calls, we understand that some of you may need to leave during the call and others may join as the call proceeds. This is designed to be an open time for discussion, so you are welcome to stay as long as you can. We're recording the calls, and they're all in a new toolkit on our SMI website that's available to the industry. And we're also taking notes on each call that will be available in the toolkit as well. On last week's huddle call, we had a panel of suppliers, Laura Latham from Stryker, Kevin McMillan from Steris, Jim Goodman from Smith & Nephew, and Keith Lowcamp from Workday, who shared their insights on the supplier perspective on the recovery planning phase of this crisis. And we really appreciated their comments. The notes and recording from that call are all available on the COVID-19 toolkit on the SMI website. Christine?
Thanks, Nancy. So we currently have you all on mute during our opening remarks. We have a bit more structured agenda today just to make sure we can provide your input on SMI initiatives. We will be having some polling questions for you, and we'll have some structured questions for the panel as well. We will also have an opportunity for you to share your thoughts and ask questions of the panel. And to participate verbally, you can raise your hand by clicking on the hand icon, and we'll call on you and then unmute your individual line. You can also type questions or chats into the box in the window on the right-hand side, and we'll include as many questions as we can in today's discussion. Nancy, back to you.
Thank you, Christine. Today, I'd like to welcome Karen Conway from GHX, Tom Harvieux from BJC, and Dennis Orthman, SMI's new project consultant, who are all involved in current SMI initiatives. Our topic today is SMI initiatives, where we've been, and more importantly, given this recent crisis, where we should be heading. Our panel will share some thoughts, and we're also looking for insight from this group as we really begin the work together to define where SMI can best lead the industry into the new normal. These discussions will continue through our Vision 2020 series. We've got some special events planned where we get a chance to share with members, having members share ideas about initiatives. And then after we're finished with our Vision 2020 series at the end of June, we'll be finalizing some new direction for initiatives over the next couple of months. To get started, I'd like to briefly review our SMI initiatives and where we've been. Christine, can you share the slideshow? Just in case we've got some newer members on the call, I wanted to make sure we talked through just what an SMI initiative is and the kinds of approaches we've taken in the past and where we want to go. We think an SMI initiative focuses on a clearly defined problem. It reflects and represents the intersection of providers and suppliers that's really core to SMI. We look for it to be member-led and team-based. So these are really member-driven initiatives. We've got people like Dennis and other consultants who help us out, but Karen, Tom, and all of our other members who are leaders of these initiatives are really key to those that work. Typically, they're strategic. We're looking for a way that we can guide the industry from our SMI executive members. And then it produces a tool that's open source. So we've got on our website, as you all know, we've got a listing of all of our tools, and anyone in the industry can download those tools at any time as a free service to the industry. So we're just taking our leadership role, turning it into some tools, and making them available to the industry. Next slide, Christine. We currently have 2 active initiatives plus one that's coming to a close. So the one that's not here listed is our value-based collaboration initiative. And on July 8th, that team is going to be giving a report out of their findings and their work from that initiative. And then that initiative as a standalone event will come to a close. Value-based collaboration will always be core to what SMI does, but that particular initiative as a standalone project will be ending in July, and it's really finished now, and they're going to be giving a report out in early July. But we've got these two initiatives going on right now. We've got the Clinical Integration Initiative, who their original objective was to publish a maturity model on clinical integration to help guide the industry. They wanted to develop a playbook to help advance supply chain down the path to full clinical integration. And where they were working before the crisis hit was they were comparing other models, other maturity models, to find gaps where SMI could best add value. So they were really focused on the maturity model guiding the industry to a more clinically integrated supply chain. And the Supply Continuity Initiative was the other initiative that was headed up by John Lebowitz, who has ended his contract with SMI, and now Dennis Orthman has stepped in. That continuity initiative was focused at the time on developing a top 100 critical items list, looking for ways to address chronic back orders, creating, oddly enough, crisis management playbooks, but we didn't get those done quickly enough, and the crisis hit without our having a tool ready for it, and was done in collaboration with HUDDLE and ARM. So I really wanted to just share this with you today to let you know what the work was going on that was going on before, early March, where our initiatives were, and recognizing that now that COVID-19 has really refocused all of our activities, we want to make sure that the initiatives going forward are relevant to the COVID-19 crisis and what our hospitals and our healthcare systems need coming out of this, and our suppliers as well. So that's kind of where we want to start the discussion today. And to get us started today, we wanted to start with a quick polling question just to get some insight from the participants on the call. And Christine has opened the poll. The question is, as we move into everything I think everyone is calling the new normal, how do you think the healthcare industry will respond to what we've learned from this crisis? So do you think that we're going to go back to the status quo? Do you think the healthcare delivery model will be radically changed? Or do you think the new normal might be a combination of A and B? If you can just take a couple of seconds to answer that question, and then we'll share the results with you as soon as we get our answers put together. And while we're waiting for that answer, I do have a question to start with the panel, and that is to ask, what do you think are the biggest challenges and risks for the healthcare supply chain between now and the end of 2020? So Karen, I'd like to start with you. If you could share with us what the challenges and risks are in the next, 6-8 months, and what you're concerned about the most in terms of the impact of this crisis has had on our healthcare system.
Sure, absolutely. I mean, there's obviously lots of different places we can go, but I want to speak to something that I really got a better appreciation for this morning. So I have an opportunity to co-facilitate a panel of CFOs with HFMA, and we were on a call discussing a lot of the COVID-related challenges that they're facing. And one of the things that really stood out is that there's no normal demand curve. So one health system in one state was talking about the fact that they were picking up the phone, calling patients and saying, hey, we're open for business. You can come in for that non-urgent procedure you've been waiting for. And many of them are still refusing to come in. Whereas in other areas of that same healthcare system, they said they have already surpassed their pre-COVID levels. Another system was talking about the fact that they expected a surge. It never showed up. And they were at one point at 30% of capacity in the hospitals. But now they're in a state that reopened big time this weekend. They said the bars were packed, and now they're concerned that they might have a surge. So it's kind of like it's different in different parts of the country, even different parts of the same state or the same system. So it requires that agility and that flexibility. It requires that coordination with suppliers, constant monitoring of what is the demand, certainly getting that visibility of inventory. How much do we have? Where is it? What are the consumption rates? What's in the pipeline? Logistics, I would say, to get products, like if we start doing more hospitalization at home, perhaps for patients who don't want to come in, that changes the logistic model. And then I think finally the biggest one is the issue around at-risk patients, because the fact is that patients of color are often less apt to have access to broadband for for virtual care. They might be less trustful of the system, less willing to be tested and to share data. And we were talking right before this about how most systems are seeing their ER and their urgent care volume down significantly because people are afraid to come in. But when they are coming in, they're often coming in by ambulance. They're much sicker, et cetera. So we've got to manage all of these dynamics all at the same time, and with many of them unknown.
Thank you, Karen. And Christine, do we have polling results? There we go. So most of the folks, no surprise, 75% of the answers of the participants answered that they think the new normal will be a combination of A and B, going back to the status quo, and a combination of that with a radically changed healthcare delivery model. And some of the folks, we got 25% of the folks thought that we really would just be going into radical change. So that's an interesting perspective, but I think not surprising relative to what we expected. So thank you, Karen. And Tom, any thoughts on what you think are the biggest challenges to the healthcare supply chain between now and the end of 2020?
Absolutely. I would build on what Karen lifted up. There's a couple things. One, a lot of concern and weariness around a resurgence of COVID. It's not about if it's going to come back, when is it going to come back, is really the sentiment in a lot of the healthcare systems, that our health system and a lot of other health systems that we talk to. So a lot of monitoring around testing, making sure we have the right PPE to start the procedural volumes back up, but also to know and be prepared for when it comes back. Equally with that, as we ramp up elective procedures and other procedures across the organization, you have half of the team that worked in the ICU that is stressed out, burned out, and then you have the other half that was either at home or idle or had less time available that really want to get going and get back in the game because they've been sitting on the sidelines and not doing surgeries. And the organizations are trying to balance that response across the team. So we have to work through that. Lots of energy going into that work, but certainly all the organizations are being really driven to bring that volume back and bring the revenue and the patients and deliver care to our communities again. With that, we're strained financially. Most of us have taken tens, if not hundreds of millions of dollars in losses since the March ramp up across the United States. That can come in forms from losing half of your margin with elective procedures, doing furloughs, laying staff off. You see that across the country, that the organizations have really been decimated by the financial impacts. In a lot of cases, the CARES dollars only make up for a very, very small portion of that. And the organizations are trying to work through that. What that will mean is we'll be challenged. I expect that obviously travel for most health systems will be frozen through the rest of the year. Capital, I would imagine, will be a very likely target for most health systems to freeze throughout the rest of the year at a minimum. And anything we can do to preserve our financial health across the organization as we work through what happened over the last 60 to 90 days and recover into operations. We will be managing still a very fragile PPE replenishment from suppliers. It is not back to where it needs to be by any stretch of the imagination. I don't even believe that we're even near back to being pre-COVID from what we received from just historical. So we're going to continue to work that, and that's important as we build up permanent stockpiles to prepare for a potential fall resurgence or until a vaccine is developed. And then we will continue to support operations while we're planning for the resurgent and making sure that we don't have any hiccups around product availability or instrument sets to make sure that we're able to effectively deliver the care that we need to do for our community. So really just two competing priorities of one, trying to manage in a very constrained environment where we're financially strained from the significant losses we've occurred, but then knowing that we have to make investment and turn the operations back on across the organization, and that will be impeded by those financial losses.
Thank you, Tom. It's a great summary of the challenges that you're facing. We appreciate that. I'm going to just interrupt. I'll call on Dennis in just a moment, but wanted to let everyone know that as soon as Dennis is finished speaking, we will open it up to questions from the audience. You'll be able, as Christine said, to raise your hand or submit a question through the questions option on your screen. So please start thinking of your questions. We'll open it up. We've got some other discussion and polling as well, but we'd love to open it up to questions and comments relative to the challenges and risks concept. Dennis, wanted to give you a chance to share your thoughts as well relative to the biggest challenges and risks for the healthcare supply chain between now and the end of the year.
Thank you, Nancy. I appreciate the opportunity to be back and part of the SMI community. And regarding the biggest challenges and risks, I think Tom and Karen covered a lot of ground there. But I would summarize it up in my mind. And we as an industry, we have to make sure that this doesn't happen again. We've been called before our colleagues within the healthcare industry about product shortages and issues. And we've also been called out by the public in some ways about the healthcare supply chain. We never got this much attention before. And as Tom said, the concern about future waves and resurgence of COVID, we as an industry have to make sure that the situation that's been experienced, whether it was real or perceived, that does not happen again. We have to restore confidence amongst our customers and amongst the public as well, that we can supply. And this is going to be done very quickly, hopefully, in an environment that's economically challenged. And we don't have a lot of different systems than we had 4 months ago. So we've got a lot of work to do.
That is for sure. There's no question about that. Christine, do we have any questions? I'm not seeing anybody with a raised hand, so if not, we'll just continue on up. It looks like we've got a few questions coming in. We have some questions,
Nancy.
Christine?
Yep. So the first question is, how has the COVID crisis changed how you view distribution?
Tom, that sounds like it's mainly targeted toward you, so why don't you start with that question?
We all relied heavily on distribution, and where we struggled, it was almost a perfect storm. If you look at everything around PPE that we were challenged with the starting with the shutdown during the Lunar New Year, moving into the COVID shutdown of manufacturing in China, followed by the bar of exports of those products from leaving those countries, created a huge gap in our entire supply chain. Distribution, whether we stay with traditional distribution or people look at different models of distribution, we have to have more visibility into the channel is really what it's going to come down to, because we cannot be blind to what's in the channel at all. And I always sadly make the reference that a lot of times we don't know what we're out of until we get the boxes in the morning, and we have to get very good detail into what's going on in the channel, from how many days are on in manufacturing, how many days are on the water, how many days are in the regional distribution centers, how many days are sitting in our local DCs, and being able to proactively plan and manage that. So my question really is about how we manage the channel more than what partner you use, because regardless of what partner we would use, we would have to have that visibility and better collaboration around management of the entire supply chain. Right. Definitely a concern. Dennis, any thoughts on the topic of distribution? Have you heard anything from other folks in the industry about their thoughts on changing views of distribution like Tom described?
Well, I think as in past issues when we've had supply chain disruptions, people begin to challenge the thought processes about sole source and bundling and things like that, when they realize that spreading their business around gives them more distribution channels to utilize. So the healthcare supply chains never not being pressured to lower costs, and sometimes though concentrating business within certain distributors helps you to lower costs, but sometimes it doesn't help you to in the continuity of supply. So there's a lot of challenges, and people's thinking is going to change over the course of things that have happened in the last 4 months and things that will happen in the next 6.
Yeah, that's for sure. That's for sure. And Karen, what about you? What's your perspective on the distribution, sort of the current distribution model, and how that might change as we go forward?
I think I will build on comments made by both Tom and Dennis. One of the things is, it's certainly called into question just in time. I don't think just in time is going away. I think what this does do is give us an opportunity to understand there are always trade-offs. I know Erica Daffer from Gartner has spoken at SMI about the hierarchy of supply chain metrics, and it's the concept of you need to understand the pros and cons, if you will, of different kinds of practices. The thing that I'm perhaps most interested as we think about preparing for another pandemic, another crisis of this magnitude, because Tom's absolutely right. I don't think there's anything. It was a perfect storm. Too many things were happening that we could have fully prevented this. But, there's a concept called crisis standards of care in the clinical world. When you don't have enough resources, there's certain things, there's some prioritization criteria that go into place. And so when I think about if we have to go into situations where we have to allocate in a case of public emergency, I would hope we could get to a point where the allocation isn't based on who do you have a contract with and who's your biggest customer, but more about how are we really able to determine in those dire circumstances, how do we get the products to where they are needed most? And that's going to take really a public, private, and multi-stakeholder effort.
That is for sure. It's going to take a lot of us working together to make it happen. Christine, any other questions to share with the panel before we move on to the next polling question?
We do. We have a couple of questions that have been submitted. This one is around from a supplier, and how can suppliers best provide confidence and value to health systems in this new world?
Again, Tom, that sounds like it's mainly targeted at you, so let's start with you, but I'm sure Dennis and Karen will weigh in as well. Oh, did we lose Tom?
I am muted.
You on mute by mistake? Oh, there you are.
And it was probably the most
now we can hear you.
I was ever going to say, so that I missed. So
it was awesome.
It was awesome. I would say absolutely. There's a lot suppliers can do. Suppliers are key trading partners for providers. We have to become more partners. We've talked about partners for the last couple of years, and we're trying to figure out what that means. I think one, connecting supply chains with supply chains. I think we have to move out of the sales force dealing with supply chains and HSOs, not around the contracting, but around how to operationalize and drive high reliable performance across the entire supply chain to make sure that we have good demand signals, we have good visibility, we have good planning, we're providing good forecasts, giving a lot more business intelligence and automating the data transfer between us. That has to occur. I think suppliers can help us drive towards rationalization of products. We all know that suppliers are much more efficient, as you've seen even in toilet paper and others. They quit making 42 different versions of something. They cut it down to certain SKUs because they could mass produce it and meet the demands of the organizations that are out there in the retail market. There's ways for us to have those conversations around, we need to reduce SKUs because it's easier to manufacture, it's easier to warehouse, it's easier to distribute, it's easier to manage the utilization of an organization and reduce that variation. And then anything we can do together around being high reliable organizations to make sure that we have the right planning in place around criticality. Where are we at risk? What are we going to do to mitigate that? And what are our contingency plans? And that's not someone needs to solve it for each other, but we need to have honest conversations around this is a risk area. And then the providers need to be willing to build up inventory if they want to cover that risk, or they need to take different action to cover that risk. But we've never really had any of those three conversations to really drive out the waste, the inefficiency, just the variation that we have which is almost impossible to manage in a very complicated supply chain. And I was going to talk about that in a later point, but it really comes down to we need to simplify the supply chain, because a simplified supply chain will be much more reliable.
Mm-hmm.
Thank you. That's excellent comments. Dennis, any thoughts on simplifying the supply chain, kind of feeding off of what Tom shared with us?
Well, certainly, if we've all tried to do the flow charts that are associated with this industry, so simplification is something that would be welcomed by pretty much everyone. The issue on suppliers and what suppliers can do, I recall from one of the previous SMI huddle calls with Laura Latham from Stryker and Keith Locamp from Workday. They were talking about they wanted their customers to know, and I think the customers received it very well, to know that their companies had full plans for recovery. They were in the process of executing those plans, including increased control over supply chain and things like that. So what I've heard in previous calls with SMI as well as with other people in the industry is, the suppliers can help by promoting the confidence amongst their customers that they are prepared for anything that might come in the rest of the calendar year, at least.
Yeah, and I think sharing the plans is a great way to think about it, that both provider and supplier sharing plans about what's going on in their organizations to help us all figure out the path forward.
Mm-hmm. Mm-hmm.
Karen, thoughts on suppliers providing confidence and this whole kind of simplifying concept?
Yeah, absolutely. And really, once again, building on what Tom and Dennis have had to say, I want to underline that point that Tom made at the beginning about becoming real partners. We've certainly had so many very rich discussions within the SMI community about this concept, but I think this is when we're actually going to really start to actually do it. We must do it. And I think it is a two-way street. I think suppliers being more forthright in terms of what they've been doing to mitigate risk, and when they do have a risk, because things happen, letting their customers know, hey, we are going to have a shortage because we had a fire in a facility or something. But in turn, for real partners, for those customers to say, okay, thank you for giving me the advance notice. I might have to go over and buy something from one of your competitors, but because you have been a good partner, I will come back. Or that risk mitigation, upstream risk mapping, that willingness to share data on potential shortages, being one of those things that you factor in when you are doing sourcing and you are doing agreements. And then the other thing is when we think about, it's been a lot of demands for, bring the manufacturing back to this country. That's not unusual. They're saying it in Germany. They're saying it in Canada. They're saying it in Mexico. So, we can't imagine that every country is going to be doing all of its manufacturing in that country, but there are certain things we can be doing, investing in flexible manufacturing, continuous manufacturing that's mobile and closer to the source of demand, certainly additive or 3D printing. Are there things that we can be doing, within the customer environment to be supporting the ability and perhaps even rewarding the ability of manufacturers to start investing in some of those advanced manufacturing capabilities?
Wonderful. Yeah, it's interesting to hear. It'll be interesting to see how different countries respond and end up diversifying manufacturing. We might end up with a lot of manufacturing plants all over the world, huh? So we're gonna go ahead with polling question number 2. Christine, if you could pull that up for us. And polling question number 2 is: do you think the role of supply chain will radically change as we move into the new normal? Just 3 simple answers, yes or no, and it's too soon to tell. So we'd love to get your answers from the participants to those questions. And while you're putting your answers into those questions, I'd like to ask our next question for the panel, which really takes us into the sort of forward-thinking section of our program, which is: what do you think are the biggest opportunities for the healthcare supply chain between now and the end of 2020? And Dennis, since you haven't had a chance to go first, I'm going to ask you to go first on this question and just talk about where the biggest opportunities are for the healthcare supply chain based on what we've learned from this crisis.
Thanks, Nancy. You know, one of the things that comes to mind right away is because we've received a lot of attention in these last months, we have an opportunity as an industry to accelerate the changes that we've been working so hard to try and make, particularly around unique device identification, which then fosters transparency. So I think we can accelerate changes that we've been searching for. We have an opportunity, obviously, to be prepared for future pandemics. We have an opportunity to plan a national response as well from the industry as a whole. We have an opportunity at a provider and supplier level to develop, you know, better and more firm strategic supplier relationships based on performance and trust that's been experienced. There's been a lot of great collaboration and partnerships between suppliers and providers over the last few months, working together, and we need to document it and recognize it and maximize the value of those relationships. During times of crisis, sometimes the best in people really comes out, and I think everybody's learned a lot in the last couple of months. We can't forget that so quickly.
Yeah, and we're coming back again to this idea of partnership and relationships being so important to coming out of this crisis and being big opportunities for us to really make change. Great points. Tom, what are your thoughts on getting us on the biggest opportunities for the healthcare supply chain between now and the end of the year?
I think there's a couple key things. One is I think healthcare providers are going to be a lot more self-sufficient. I think that we had a false perception that we were going to be able to tap into the national strategic stockpile. We were able to get resources in times of pandemic. I think that we've all realized that that is not the case, and we have to be more prepared. So I think we're going to see us doing a lot more work around being prepared, having contingency plans to manage through these things. The challenge is every time I've done that, I've been wrong. I've always picked the wrong things, whether it be Ebola and then there's a hurricane or there's something else. I think that will be one. I think second is, to Karen's earlier point, we have to capitalize on the wartime mindset. We were in a wartime mindset. We were making decisions around products. We were as an organization moving at the speed that the situation demanded of us. We need to keep that going, and we need to apply that to how we look at care that we deliver, the setting of the care we deliver. Are we going to jump to virtual? Are you going to move to more ambulatory? I think even down to the products or the SKU rationalization that I mentioned earlier. So that keeping that wartime mindset. The third is, we have the attention of the healthcare executives. They are, if I haven't talked to my CEO at least 10 times a day over the last 3 months, it's been 20 times a day. We have the organization's attention, and they will not tolerate if we let this happen again. So we have to make radical changes in how we deliver services to the organization. And that comes down to simplifying the supply chain, streamlining the visibility, doing better partnerships, the things I talked about. And then lastly, we need to collaborate with our peers and our suppliers to really do that work ahead of us. So that's what I think we have to do. And if there will be people that fight that, there will be people that participate in that, and the people that will embrace it. I believe the people, suppliers, and healthcare systems that will embrace it will be the ones that emerge from this stronger than they did going in.
Excellent. Excellent. It's incredible about the change in how often you're talking with your CEO. I hadn't heard that quite that amount of difference, but it does provide some opportunities for attention and getting some change that maybe we've wanted to have happen for a long time. Karen, thoughts on the opportunities for the healthcare supply chain?
Yes, absolutely. And again, building on Tom and Dennis, that increased attention is also a great teachable moment. I think it's a real opportunity for supply chain leaders in hospitals to educate their executives that supply chain is not just about procurement. It's not just what happens in the basement or in the shared service center, but that supply chain is this end-to-end and highly complex process that really should always start with the end user, the patient, and the clinician who's using the products, and working back, but then it goes upstream and it requires that partnership, and I would say, once again, that data sharing, particularly as we think about inventory. So, I know there was a paper published about 10 years ago by Gartner on the need for bi-directional visibility in the healthcare supply chain, much like there is around inventory, much like there is in other industries. Well, this is the tremendous opportunity to start doing that. And again, as I said, adding that to the things that you're considering when you are sourcing and considering strategic partnerships. It's not just price. It's not just clinical evidence and matching to the patient need, but also who is that supplier and are they a partner? And in turn, it works the other way around, because I think as hospitals too are getting better understanding across their systems, or healthcare systems across the system, of how much inventory do we have? Where is the inventory? How much are we consuming of the inventory, normal and in crisis times? That's starting to lay that groundwork back upstream, and maybe we'll actually get to demand sensing and demand planning.
Excellent. That would be a great outcome of this crisis. Christine, we do have the polling results. Do we want to share those with the audience? So 70% of our audience believes that the supply chain will radically change under the new normal. So that certainly does give us a lot of opportunities to take advantage and make things better. So we'll look forward to SMI being a part of that with all of our members. Christine, I think we also have a bunch of questions coming in from the audience.
We do. So there's a question about that all SMI suppliers have developed very specific plans to bring actionable solutions that will assist providers during the COVID crisis now and into the new normal. How can we increase the communication, collaboration, transparency, and trust so that we can shorten the time it may take to bring these solutions to you?
So Tom, you seem like the man of the hour today. That really, again, is a more provider-focused question. I'm sure Dennis and Karen will have some thoughts on it as well. But how can suppliers shorten the time it takes to bring the solutions to you to help you address the issues that you're facing?
I think the fastest way is email or a phone call with our sourcing team leaders around where you stand in your supply chain, what you've done during the COVID when the organizations have been focused. Have you continued to produce? What's your inventory levels? What's your position? Asking us for forecasts on case starts and starting to do that rudimentary inventory planning to make sure that you have sufficient inventory, but also if you're an implant company, that you have the instrumentation available as well, and giving us that, because right now we're in the process of, we pulled forecasts, at least in our organization, we're reaching out to our key trading partners to provide that forecast information to get validation. But I think an effective partner would proactively provide that information to the organization around what the health of your inventory, asking us for forecasts so you can then reconcile that to ensure that there's sufficient product to support operations.
And what's the best way, Tom, to get that kind of start that information exchange with you? Because I know the suppliers have been trying to be respectful of kind of keeping out of the hospital's way to the degree that it's possible. So is it best to start with email, or what is best to start with sending you something? What's the best way to start that?
Well, I can tell you what we're doing, and I think it would be just the reverse of it. That we're actually, we had our inventory planners pull our demand for the next 6 months, where we think we could have, by timing and phasing of cases, and then email it out to our key accounts and have them share that with their supply chains and make sure there's sufficient inventory available, and then following up with a call with the top 20 suppliers that have the most of our volume. I think that could be done. It's very similar by emailing and following up with a call and saying, this is where we're at. Let me walk you through it, where we're at. Here's our areas of risk. Here's the areas of that we're really strong in. That transparency will be very helpful, because I was amazed that all of our attention was focused on COVID-19 for almost 60 some days. We talked about opening up elective procedures, and we immediately started to rush product in. And I just scratched my head and said, how can we rush product in after being idle for 60 days? Why don't we have inventory to support a case that's going to happen in 3 days?
Yeah, that is surprising. That is surprising. So, Dennis, any thoughts to add to Tom's on shortening the time of suppliers bringing solutions to providers?
I've heard from a lot of folks that, because there's been a lot less supplier representation on the hospital campuses, that, communication is being hampered. And in some of the innovative systems that I've talked with and heard about are really utilizing their supply chain department websites to communicate to the masses of their suppliers. I congratulate Tom on being proactive and actually emailing information to the strategic partners and initiating the conversations. I think another opportunity to enhance that information exchange is to utilize things like this call or the SMI Vision 2020 that's coming up, and involving members of your team to work with their peers and to share best practices and things like that as well. So you can't forget about just because people are not getting together in person, we can't forget about the need to continue to network and connect people so that practices and solutions can find the problems.
Good point, and thanks for the plug for Vision 2020, Dennis. I appreciate that. Karen, any other thoughts on suppliers bringing their solutions to the supply chain folks?
Well, I think it's, I think that whole idea of providers being proactive, if you will, in letting the world know, letting suppliers know in particular, what their plans are. Because to my point at the very beginning is that you do not assume that the situation of your customer in one part of the country or even one part of the state is the same as another. So, and I suspect that a lot of SMI suppliers or industry partners have not just product, but also maybe other kinds of solutions that they could offer. The one thing I would do is I would suggest that suppliers listen first, ask the question in terms of where are you, what are you prioritizing, listen to their needs so that you can be, presenting any solutions that you have within the context of what that particular customer needs, because one customer is likely to need something different and be in a different situation than another.
No doubt. There is no doubt about that. I do have one more question from my end for the panel, and that is really looking at opportunities for transformation, and I would say almost innovation. Where do you think there are the best opportunities for transformation and innovation of our full supply chain, from manufacturer through to the hospital, for transformation and innovation based on this experience? Maybe I've got sort of a short timeline on the question here on the slide, but maybe even going forward, where do you think the best opportunities are for transformation? And Karen, I'm going to ask you to go first on this question to talk about. I know you've done a lot of work on innovation and transformation and thought about this a lot.
Well, I'm still thinking about this a lot, but I think this one really intrigues me, particularly related to collaboration and innovation. So if we think about, every crisis it actually does spur innovation. Things happen faster, and we've seen a myriad of things like that happen. But if I think back to my days, so I left healthcare for a while, went into the energy business, and I was in charge of crisis communications and crisis planning. And what I learned there, we used to bring people together. We would do tabletop exercises. And my thought was, oh, this is great because we'll think through all of the difficult questions that you don't want to be mulling over during a crisis, because you want to be able to act fast in that golden minute, if you will. But we brought all the players together, and I realized that it was more about getting to know one another, those people who will be on the front lines with you. And oftentimes those could be kind of natural competitors. So whether it's, competing hospitals, or typically hospitals that might be competing for market share, are suddenly working together. One of the more interesting stories from a couple of weeks ago was, two manufacturers, Boston Scientific and Medtronic, collaborating with a provider in Minnesota to create a lightweight type ventilator. Or in doing my research for an article this weekend, really looking at places like St. Louis. Tom and I talked early on in the crisis, and I'd also had a chance to talk to Vance Moore, who many folks know from his many years working with SMI from Mercy. And both Tom and Vance talked to me about the fact that, we've already started meeting, peer to peer, talking about, anticipated demand, what kind of capacity do we have, will we possibly need to share resources, or can we go together to a manufacturer who might be able to pick up some of the slack in terms of making gowns or face shields, what have you. And I started looking at, why is it that hospital systems, besides the fact that, there's some great hospital systems in St. Louis, but there's a culture of collaboration. I discovered there's a regional St. Louis hospital-based violence prevention program that involves many of these hospital systems. BJ Collaborative, brought together systems in Missouri all the way through to Kansas City and Illinois to work on other kinds of emergency response. So my question would be, how is this collaboration, these newfound relationships? Certainly, we're not always going to be in crisis mode, but there's some more trust that's being built. And are we going to be able to leverage that to create faster transformation? And especially as we start thinking about where, a more distributed healthcare system, one that not everything is happening in the hospital, but more hospital at home, more telemedicine, more outpatient care, more care at, the place of work, the place of school, et cetera. Lots of opportunities for supply chain, but no one entity can do it on its own.
That is for sure. Tom, thoughts on transformation and innovation based on your experience and what you've seen and what you think we need to do going forward?
Yes, I agree that I believe that as a society, and healthcare is a reflection of our society, have changed radically over this last couple of months. I think we're just different. I think with the way we receive our services, the way we interact with each other, the way we are now comfortable with being remote, doing things virtually, I think it's changed a lot. I think healthcare is going to do that. So one, our healthcare supply chain needs to adapt to a service delivery model that's different than what we're used to, carrying stuff up to the floors, getting them to non-acute, getting them to ambulatory surgery centers. I think potentially more home care, more virtual care, more direct care. We have to change to support a different model. I believe that we have to do a lot of readiness in our organization to get caregivers and physicians to care. They need to care about why should you have an effective supply chain. And what does it mean? What are the trade-offs? If you reduce products and SKUs, what do you get for that? Do you get high reliability that we don't ever have to worry about making sure that you have the supplies and equipment to do your job? We can drive towards standards of care. We can have protocols for nursing around fewer products that deliver more reliable, consistent care because we have hardwired processes without lots of variation. We have to get them to understand that not only through that that standardization, we can improve care, we can deliver high reliable service, but we can also do things like clean up our data, do bedside scanning of products and recording of that, and really getting robust intelligence to actually transform care. Ultimately, from a supply chain perspective, we have to support those new care environments. We have to get visibility into the channel. That will be, I talked about that a couple of times. We have to look at supplier risk mitigation to make sure we don't get caught off guard again. And we need to look at how we simplify the supply chain. So wrapping up the first two questions, really, we have a lot of work ahead of us, but I think we have the attention of the organization, and the old saying is, don't let a good crisis go to waste. I think we need to move quickly before we do revert back to the way it was.
Yep, that's a great way to look at it, Tom. Thank you. Thanks so much to our panelists. We did want to take a few minutes toward the end of this session. We've just got a few more minutes left, but we wanted to share with you a couple of thoughts that we have on initiatives going forward and some work that we've done on an SMI toolkit for the COVID-19 recovery that we would love some member help on. So I'm going to just review here the three topics that we've got in that toolkit that we're building. Dennis is working on a roadmap to recovery. He's going to share in just a moment. We're working on a potential hospital checklist that'll give suppliers a sort of standard form to use in terms of what they need to be prepared for as they re-enter the hospital facilities. And then we'll share some brief information about the elective surgery survey results. We did conduct an elective surgery survey of members and got a limited data set, but we thought it was still indicative of what's happening in the marketplace. So Dennis, I'm going to turn it over to you just to share with folks the concept that you're working on for this roadmap, and then we'll talk about the other two tools briefly as well. Next slide, please, Christine.
Thanks, Nancy. And when I was asked to become part of the Business and Supply Chain Continuity initiative, I've got the opportunity to look at some of the great work that the team's been doing for the last 9 to 10 months. They've got a great team with a lot of provider activity. Lisa Holman from Concordance and Craig Colford from Memorial Sloan Kettering are the team leaders, and we see an opportunity here to pivot this initiative, which had a very broad scope, which included crisis management and emergency response within the scope, to actually produce a quick 2020 COVID recovery document, an executive briefing of some sort, strategic guidance, as was mentioned earlier. As leaders, SMI can communicate to the rest of the industry what is top of mind right now, and obviously this information becomes less valuable unless it's timely. So we see the need to get something out in the next couple of weeks, and this can be part of an opportunity to repurpose this team and focus more on the emergency response and crisis management part of the business continuity initiative. We're looking for volunteers. We've put together just a couple of slides here. The thought process on producing quickly a document is to talk about the priorities for the COVID recovery. Many of the things that we talked about on this call already, preparing for resurgent waves and engaging in these prioritization efforts that are underway right now, as Tom had described. We've got to redesign processes for staff and retrain staff and restabilize these PPE programs, amongst many other things. Christine, you can show the next slide. The thought process up to this point, we're looking for volunteers, is to quickly produce a list of major strategic steps. These were just examples, and some quotes from the SMI thought leaders who are contributing in this. We're looking for volunteers to do this, and this is just one part of what we hope is a COVID-19 toolkit that will also involve some information on the checklist and the elective surgeries. We've got a partnership with HUDDLE as the collaborator that they've said they'd like to work with us on this. So we're looking for volunteers for the next couple of weeks, people who can contribute perhaps a 1-hour conference call with me and some email back and forth. and members that can provide insight and input into the development of a quick executive briefing tool. I think the next slide shows our next steps to finalizing the tool. So we're looking to see folks if they can help. We've got the partnership with HUDDLE, and we may reach out to ARM. Everybody's very busy right now. There's also a June 2nd recovery panel discussion that's scheduled as part of the Vision 2020 activities within SMI that we would share some of this information with, and then we release this SMI recovery toolkit. So Nancy, I don't know how you want to ask for volunteers here.
So there's two ways people can volunteer. You can either put your name and email address into the chat box here while we're on the session, or you can email me at SMI with your information, and I will connect you with Dennis and get you into the work with him. So again, either put your name and email address in the chat box if you'd like to help Dennis develop this tool, or send an email to me with your interest in participating. Thank you, Dennis. That was great, and I think we could really develop a tool that could help guide the industry. And the discussion today has been very helpful as well in helping to kind of begin to think about what the components of that tool might be. Christine, next slide. We're working on potentially having some kind of a standardized format that hospitals can use to tell suppliers what the requirements are going to be re-entering the hospital. And this is just a template that we've come up with some input from Rhett Suri at Abbott, who's working on the vendor credentialing group. And if you want to participate in standardizing, creating this standard tool, just giving us feedback, this would be just some brief email feedback on the components of the tool. We'd love to have your participation. So please submit your name via the chat or send me an email and let us know if you're interested in volunteering to participate with evaluating that tool. Thank you. And then Christine, one more slide, I think. And that is that we did do the survey of providers several weeks ago, asking them for input on key questions about the return to elective surgery. We did get a small sample size, but the results were fairly conclusive. For example, 90% of the respondents plan to resume elective procedures in May and June. 70% plan to start very aggressively in both ambulatory surgery centers and hospitals at the same time. So I'm going to be sending out those survey results to our SMI membership in the morning, and then we will be posting them on the SMI COVID-19 toolkit as well, so that you can have that for reference. We hope that this survey data helps facilitate some conversations between providers and suppliers to start talking about where those priorities are, start collaborating as we've talked about this morning, or this afternoon, excuse me, the day is running fast. And we'll, morning, afternoon. But we hope that this information is helpful, at least directionally, as suppliers and providers start understanding how they're moving back into, as we've called it, the new normal, as the COVID-19 crisis, at least for some of us, begins to subside. So look forward to having you share your thoughts on that tool, and we hope that the output is helpful. Christine, next slide, please. I think it's just our closing slide. Yeah, so what we'd also like to ask is, because today's discussion was focused around kind of priorities, opportunities, what are our challenges and risks for supply chain, we wanted to ask all the members in the audience to just put a comment in the chat box before we finish the call today, identifying what you think should be SMI's first priority for initiatives in the next 60 to 90 days. What are those key problems that SMI should work together as suppliers and providers, as a shared community? What are those key problems that we should focus on and address for the industry? So if you can all just put your thoughts in the chat box, we will assemble those and make that part of our discussion as we go through the Vision 2020 series of sessions over the next 7 weeks, and incorporate those suggestions in so that we really take as much input as we can and identify some initiatives that will be high impact, that will make the most of our member resources, knowing that everybody's stretched pretty thin these days, and will give us some really good direction as SMI to make sure we're doing the right things for the industry. I want to thank our panelists, Dennis Orthman, Tom Harvieux, and Karen Conway today. You guys have been fabulous. Really appreciate all of your wonderful insights and thoughts to help us really consider what our priorities are and what our opportunities are going forward. And thanks to our audience for your input and thoughts and engagement today. We really appreciate the questions. We really appreciate your sharing your ideas around initiatives for SMI. And for those who are SMI members, we look forward to seeing you starting next week at our Vision 2020 program. And if you are not the member from your organization, your member does have the ability to invite a few guests to some of the general sessions. So you might have an opportunity to participate with Vision 2020 in that regard. We do intend to restart something like a huddle call after we get through the Vision 2020 sessions. And we will certainly keep everyone updated as those plans proceed. But thank you very much to everyone who has participated in these huddle calls over these last weeks. We really appreciate the opportunity to share and talk together, and we look forward to continuing the conversation. Thanks so much, everyone.
Thank you.
Thank you.